Hello everyone, my name is Dr. Olusolape and today is the World Hepatitis Day, and we'll be talking about viral hepatitis in our community so that you and your loved ones can be well informed and take necessary precautions. Alright, so let's get right into it. So what is viral hepatitis? Hepatitis is a disease of the liver caused by viruses, and that's what viral hepatitis is. There are different types of the hepatitis virus, from A, B, C, D, and E. But for the purpose of this time, we are going to be talking about hepatitis B and hepatitis C, because these ones cause the most infections in our community. But why is this a big deal? You might ask. Your liver plays a very important role in your body, and that's why us talking about a disease that can affect it is important. Okay, so what are the main functions of the liver? Okay, first of all, the liver is a big organ located right here at the top right corner of your tummy. Okay, and it has various functions that help you function well. So one of the first and major functions of the liver is to clear up waste. Is to help you when you eat food, you take drugs, all the excesses, it helps you clear it up. Okay, it also plays a role in preventing infections by producing substances that help you fight these infections. It also helps with how your blood works. Okay, it helps with how your blood clots and how it flows, so that you just don't start bleeding anyhow. All right. It also helps with storing or managing your sugar. Okay, when you have too much or too little, it has a way of regulating it, so you know that your liver is very important. Okay, so now let's consider some statistics for hepatitis B. In the world, well over 250 million people are actually infected with hepatitis B virus, and in Nigeria, well over 16 million of us have this virus. But that's not even the interesting part. The interesting part is that only 10% of people that have this virus know. Only 10% of them are aware. And of the people that are even aware, only 16% of this large number of people are on treatment. So what are the ways people can get hepatitis B virus? The main mode how people get it is through blood and body fluids. Body fluids like vaginal fluid, semen, menstrual fluids, and the likes. Okay, and then the common routes of transmission are from a mother that is infected to a newborn child. Okay, that's a very important route, and also through sexual intercourse, sharing infected sharps, needles, razor, when you go to the barbers and you're not sure the clipper is well sterilized, blood transfusion that is not properly screened, okay, and the likes, through blood and body fluids. That's how hepatitis B virus is spread. Viral hepatitis B infection can be acute or chronic. Now, it being acute or chronic doesn't mean like the strength or how severe it is. It actually has to do with the duration of the disease. So an acute infection is something that happens within a 6-month window, and anybody that still has hepatitis B after 6 months is called chronic hepatitis B infection. Okay, why that is important is because the person can be infected with hepatitis B virus, and the body's immune system is able to clear it up, okay, within 6 months, and the person is immunized and the person is good to go. But someone that has chronic hepatitis B virus infection has had it for more than 6 months, and the body by itself has not been able to clear out the disease. What are the signs or symptoms you might see when someone has hepatitis B infection, virus infection? Most times, people that have these infections do not know, and they do not have any symptoms actually. But sometimes they might have a very small percentage of time, okay, in the early phases. So the common signs and symptoms include the yellowing of the eyes, what we call jaundice. Okay, person might have abdominal pain, tummy pain. Person might have a swollen tummy. Okay, the person might be extremely weak or tired. The person might bleed easily, and when they have a cut, doesn't clot on time. So these are some of the symptoms. Alright, the person might have dark urine, pale stools. Okay, and these symptoms sometimes they can occur in the acute phase or in the long-term chronic phase. So how does someone know that they have viral hepatitis? Well, the only way to know and be sure is to have a blood test done. There are several types of blood tests that can be done. Okay, but most times in most centers you just have a simple needle prick and you get tested to see your results. Then based on your results, further tests can then be done. So treatment for hepatitis B virus infection can be based on symptoms and also can be channeled directly at the virus. It is important to note that treatment for hepatitis B is that treatment, not a cure. About 95% of time, people still need to continue using those drugs for life. So the drug doesn't promise a total eradication of the virus, but it does well in suppressing the level of the virus in the body to keep the liver healthy and to slow the damage that is being done on the liver by the virus. It is important to note that most times in some places you are given supplements with the promise that it's going to cure your hepatitis B infection. All these nutritional supplements do not cure the virus. What they do is to help your body respond better to the disease. What can treat hepatitis B virus infection is an antiviral drug. And even that doesn't cure it completely in over 95% of the time. What it does, like I said earlier, is to suppress the replication, the spread of the virus. And most times when you are eligible to start treatment, most people have to continue taking these drugs for life. Well, there's good news for viral hepatitis B in that there's a vaccine that can prevent people from getting this disease. And this vaccine is available for children immediately they are born and in 2 subsequent booster doses. And that suffices for up to 20 years, and some studies say for life. And then adults that are at risk of having the virus but haven't had it yet should also get vaccinated to protect themselves. Alright, so now I'll speak briefly on hepatitis C. It is strictly blood-borne, meaning that it is transmitted strictly based on blood. So those things that we listed earlier for hepatitis B, also in terms of transmission, they also pertain to hepatitis C. It's important to note that people that have hepatitis C, they are more likely to have a liver cirrhosis, which is like a failure or a severe damage of the liver, and to have liver cancer. Both hepatitis B and C can cause liver cancer, but hepatitis C has a higher risk of doing that. Another important thing to note is that unlike hepatitis B where there is no cure, hepatitis C does have a cure. It has a drug that can actually clear out the virus. But also unlike hepatitis B, hepatitis C does not have a vaccine. So we see one has a vaccine and one has a cure. Alright. Hepatitis C also affects a significant number of people in the world. About 71 million people are infected with viral hepatitis C, and about 400,000 of those die from this infection due to liver failure and liver cancer. In our country, about 2 million people are infected with viral hepatitis C. So how do you get yourself protected against these viruses? The first thing is to know your status. Get tested. know whether you're infected or not. All right. So if you get tested and test positive for any of this, your doctor would advise the next best steps to take. But if you do test negative for viral hepatitis B and you have not in previous time completed the vaccination, you should please dedicate today, this week, to ensure that you start your vaccination. It's you get a dose when you present to your healthcare provider, then in 1 month, and then 6 months after that, and that covers you for at least 20 years. I like to emphasize the importance of mother-to-child transmission. The reason this is very important is because for hepatitis B, the people that go on ahead to have chronic hepatitis that leads to liver failure and to liver cancer, a significant amount of them were people that were infected when they were very young. So it is very important to take note of this. As a pregnant woman, you should present to the hospital during your antenatal care and ensure that you get tested for viral hepatitis B. If you do get tested and you are positive, your doctor would advise you on the things to do and the preparations to make. For example, your child at birth is supposed to get a drug called an immunoglobulin. So you need to start preparing to ensure that your child gets that in a timely manner. Okay? And please, mothers that have just put to bed or expectant mothers, you should plan and ensure that all your children get vaccinated against viral hepatitis B according to the National Program on Immunization. Alright, so we've talked about how people get viral hepatitis. So what are things you need to do to protect yourself? Well, ensure that you protect yourself from blood and body fluid of people. Okay, and you can do this through safe sexual practices. We know the ABCs of safe sex: abstinence, being faithful to your partner, and then using condoms. Ensure that you do not share shaps. Okay, have your own personal shaps at the salon, when you are going to get a haircut at the barber's shop. Okay, when you are going to get a pedicure or a manicure, ensure you have your own tools. Alright, you should also ensure, like I mentioned earlier, that you go for your antenatal care and you get tested and you get your children vaccinated. Okay, so if you have hepatitis B and your partner, your sexual partner, doesn't have, it is very advisable that you ensure they get tested, and if they are negative, they should get vaccinated to protect them and to protect your family. Do not share intimate things like toothbrush and all that. Okay. And if perhaps you are in the hospital or with your healthcare provider and you need to get transfused with blood, it is your right to ensure that that blood is well screened for HIV, hepatitis B, and hepatitis C before taking it. Please do not be in a hurry to take blood that has not been properly screened. And if you're in the hospital, you are to be watchful and ensure that all the sharps and instruments that are being used on you are new or well sterilized. And also, if you're a healthcare worker, a cleaner in the hospital even, please ensure you use your proper personal protective equipment, like your gloves, to avoid having a needle stick injury. So we talked a lot about viral hepatitis B. So what are the ways people cannot get this virus? You can't get it by talking to someone. It's not coronavirus. You cannot get it by sitting close to someone, or by even hugging someone, or using their spoon to eat and things like that. If someone has viral hepatitis, your friend and your family, they don't need your discrimination. What they need is your support, to ensure that they get their necessary treatment, and you encourage them to live the best life that they have to live. Okay, so in closing, let me share an interesting fact with you. Did you know that hepatitis B virus can be up to 50 to 100 times more effective than HIV? So you see why it's important that you and your loved ones take the necessary precautions and stay informed. Happy World Hepatitis Hepatitis Day.